Hello everybody. Today I am going to give you all the information you need regarding total hip replacement. Total hip replacement is a surgery where the ball and socket of the hip joint is changed. The conditions where you need total hip replacement is either due to fracture or trauma, the head is fractured, or it can be because of arthritis where the joint surface is damaged, or it can be because of avascular necrosis of the femoral head. In total hip replacement, the head and the socket both are replaced. The head is replaced either with a titanium head or a ceramic head. The socket is replaced with a polyethylene socket or a ceramic socket. The implants available currently are divided into cemented implants and uncemented implants. Cemented implants are generally used in patients who are osteoporotic and the bone doesn't have holding capacity. Uncemented implants are used in patients who have got good bone and they have got a holding capacity. In uncemented implants, there are different types of metals used such as cobalt chromium, titanium, zirconium, and for the surfaces which are rubbing against each other, either the surface can be poly on metal, poly on ceramic, or ceramic on ceramic. These different types of surfaces and metals combinations are used according to the need of the patient. Hip replacement surgery is a very crucial surgery and most of our movements, walking, running, jumping, jogging can be restored with a good hip replacement. The hip replacement surgery is a major surgery, so pre-op preparation of the patient is crucial. Patient needs to be investigated thoroughly for a major surgery. During surgery and after surgery, patient needs to be kept in the hospital for around 3 days. Patient can walk very next day of the surgery and can go home in 3 days. After hip replacement surgery, patient will need intensive physiotherapy for almost 3 to 6 weeks, and patient will need to avoid few things such as sitting down, sitting cross-legged for at least 3 to 6 months. Patient may not be allowed to sit down and sit cross-legged for lifetime depending upon the stability of the implant. So hip replacement surgery is an extremely successful surgery if done in expert hand. Thank you.